It was actually very well tolerated, and to give you, again, a perspective, if you think about it, it was done across, pretty much every continent, except for Africa, I believe, and you were able to get all these patients and studies through the different data safety monitoring boards, and you were still able to complete the study. So it tells you that it was actually very well tolerated. And when you looked at the toxicities on the initial presentation of Surflox, they were actually all that was anticipated and nothing more than that. So patients were able to get through as many cycles of chemotherapy if they got the SIRT spheres up front or if they got the chemotherapy alone. And that tells you that there really was not a significant additional toxicity. The only other thing that probably was a little bit different was there were some initial, almost user-related, so the technique was developing initially, and there were a lot of maybe issues from the technique itself. And so initially on the study, there were a few more toxicities on the SIRT spheres arm, but when you look at the overall study and you look at what happened throughout it, you were able to get as many cycles of chemo on both arms, so it was pretty well safe and tolerated.